Older people are a nation's memory. When society fails to look after its older people's memory, it is denying its own roots. One of the gravest challenges facing Latin America is the rapid aging of its population. The number of people over the age of 60 will increase from 68 million in 2015 to 102 million in 2025. There will be a particularly significant increase in the 80-plus age group. The increase in the number of older people is directly related to an increase in cases of dementia and especially Alzheimer's disease. This is a group of mental illnesses that alter brain functions such as memory, language, concentration, orientation, and social interaction in general. The World Health Organization estimated that in 2010 there were 7.7 million new cases of dementia around the world, or 3 times the number of new cases of AIDS. This figure is so high that even though it's not a contagious disease, dementia is described as this century's new epidemic. Because Latin America is aging faster, the increase in dementia is inevitable. It is estimated that in 2010, a total of 7.8 million people were affected, 4.3 million in North America and 3.4 million in Latin America. Despite the lack of exact figures, the prevalence of dementia remains constant, affecting between 5 and 8% of people over the age of 60, 50% of whom have Alzheimer's. Fewer than 10% of people with dementia are diagnosed. This means that most people do not receive the care they need.
Alzheimer. Eso me dicen, no sé.
Pero hay momentos que como que pierdo la cabeza.
¿Qué me recuerda? ¿Cómo que será?
De mi pueblo querido. ¿Y ustedes de dónde son? ¿Quién soy? ¿Su hermana, su amiga, su esposa? ¿Qué sois?
Hermana.
¿Su hermana?
¿Qué edad tiene usted? ¿Cuántos años tiene usted?
No me acuerdo.
¿Se acuerda cuántos años tiene?
Dementia is a serious public health problem because of its negative impact on the family and society. Many people who have been diagnosed with some type of dementia are sometimes aware that something isn't right, that they don't respond in what is considered a normal way. They easily get disorientated, they have unexpected lapses or forget things, or they experience unusual changes in mood and emotions. This is not part of normal aging. It might be a warning sign that should be responded to immediately, because the early symptoms of a mental illness, especially Alzheimer's, will go on getting worse. This usually means that the person will gradually lose their independence, making them dependent on others to go about their daily lives. Dementia is not like other illnesses because its impact on the person affected and those around them is not just about health. It has very significant repercussions on the person's family, their carers, and the community they live in. Although there's no cure for dementia, some of its impact can be lessened by slowing down the rate of progress of the symptoms. In response to this alarming public health problem, the Mental Health and Dementias project, called Forget Me Not, was carried out from 2013 to 2015 in the Andean countries of Colombia, Peru and Bolivia. With the aim of improving the quality of life of dementia sufferers and their families, older people with dementia were provided with care and health service staff were given training, as they don't usually know how to provide the proper care.
Y ahora después de eso me vinieron a visitar el grupo de ustedes y eso me ayudó bastante, porque de allá para acá me sentí muy bien, aquí tuvieron una charla conmigo y yo seguí siguiendo lo que ellos me dijeron y eso me sentió bastante bien.
Me gusta conversar con las personas, me gusta salir a la calle, ya no puedo salir casi, pero me gusta todo eso.
In Bolivia, with the support of the Bolivian Alzheimer's Association and Fundación Horizontes, the project worked in the Department of La Paz and the city of Santa Cruz to improve the care provided in first-level health services, as well as raising awareness in communities and older people's organizations. In Colombia, The Montes de Maria Development and Peace Network Foundation worked in the north of the country with older people's organisations and the community, coordinating with health services and the Victims Unit brigades to introduce appropriate mental health care for older people in a region heavily affected by the armed conflict. The Colombian Family Action Against Alzheimer's Association, AFACOL, increased the training it provides to carers of Alzheimer's patients and provided support to their families. In Peru, the Memory Institute, IMEDER, used its high-level technical expertise to raise awareness in rural communities, identify patients, and advise the local government on how to implement actions to benefit older people. Meanwhile, in Lima, Grupo Vigencia gave training courses to carers and family members, as well as coordinating with carers and the local government to set up carers networks. Going beyond the numbers, what the project demonstrated is that it is possible to change the situation and reduce the negative impact of dementia. It is possible to build the capacities of families and healthcare providers so that they're better able to cope with the situation. Families and communities can combat ignorance and stigma, prevent abuse and neglect, and create a more positive environment. One of the project's key tasks was its work with carers, whether they be family members or carers from outside the family. They were given training on appropriate care and learned how to recognize symptoms, manage stress, and prevent abuse.
Yo he utilizado lo que son los talleres de pintura, de sistemas, de aprender a manejar el paciente, de cuidador, de que lo cuide, de cuidarlo y de cuidarse uno.
Cuando llegamos a la Fundación Alzheimer, definitivamente aprendimos muchísimas cosas que dijimos, pero es que esto estaba pasando hace rato y no nos habíamos dado cuenta.
One vitally important part of the work was to ensure that the health services are able to detect, treat, and counsel the patient appropriately and in the early stages. Another very important objective was to reinforce society's commitment to dealing with dementia on a day-to-day basis and with an attitude of solidarity. We need to talk about dementia and Alzheimer's disease in settings where it's not seen as a priority issue, such as with local government authorities, other social groups, and the community in general. To enable the thousands of people who are already affected by this disease to cope with their everyday reality, we need to work together and set up a protection and support network that we are all involved in. The project has shown that there is still a lot of work to do, but all the people involved should be proud of what they have achieved in the project's 3 countries, the progress they are making, and above all, the hope and love they show as they go about their work.